Everybody, good evening, everybody. Welcome to the City Council Chambers. In attendance, we have Councilwoman Danielle McCray from the 2nd District, a member of the committee.
Thank you,
To my
Madam
left, we have Councilman Leon Pickett, not a member of the committee, but joining us tonight. From the mayor's office, we have Nina Thumulis joining us. And so this evening, the Labor Committee will hear City Council Resolution 20-0193R for the purpose of inviting representatives from the Mayor's Office of Employment Development and the Mayor's Office of Children and Family Success to brief the City Council on the state of the labor market, particularly regarding youth unemployment and the employment of returning citizens. This resolution was introduced on January 27, 2020. I was the sponsor of the resolution. I'm just going to start off with some opening remarks. As a fighter for the Baltimore City residents, have always tried to connect job seekers with opportunities. As the chair of the Labor Committee, I am committed to ensuring every Baltimorean has a job with dignity, and by dignity I mean a job that pays a family-supporting wage and offers benefits, including health care and paid time off. As a journalist and a councilwoman, I've heard the stories firsthand, from knocking on doors, from crisscrossing the city, to talking to residents about their experience that they have gone through to find a job to take care of their family. Over 30% of the city's working age population is not in the labor force. Of city residents who are employed, 27% make less than $15 an hour. These numbers are even grimmer when you break down the numbers by race. Baltimore's African American unemployment rate hovers over 13%, while the rate for white residents is 3.4%. The numbers reveal an ugly reality faced by many Baltimore City residents. We don't have to look far to hear the stories of the people behind these numbers and the way the job force has changed drastically in one lifetime. Elders in our community speak about the steel plants that provided jobs with benefits, lifted so many families into the middle class, and allowed for home ownership. The same elders now see their grandchildren exiting high school without adequate literacy or technical skills that would put them on a path to a trade or college. These young people are forced into a cycle of low-wage jobs in tourism or hospitality or the hospitality industry, without a real pathway to a decent living, adding to the growing number of residents who are chronically underemployed and live in poverty. If decent paying jobs are available, hundreds of city residents face significant barriers to getting them. For example, Baltimore City residents represent 1 out of 3 people in Maryland prisons. Once released, these individuals return with the pressure to secure stable employment. Because of their criminal record, many employers won't even consider them. They are forced into jobs that do not cover the basic needs or into the informal economy. This is just one type of barrier. Other major challenges include unstable housing, inaccessible public transit, and a mismatch in skills. And they all add up to form a complicated web that many Baltimoreans have limited support to navigate. As a councilwoman, we must take the lead from community members and advocate to remove barriers for Baltimoreans to enter the workforce and support their efforts to access and maintain jobs with dignity. This hearing is a part of an ongoing effort to address these challenges. Today, local experts will share a data-driven overview of Baltimore's workforce, perspective from large employers and small businesses, and most importantly, community experiences. Their testimonies, coupled with the best practices and recommendations from community-based organizations, will inform the strategies and policies this committee will focus on. I want to thank Dr. Tamar Lucas of Coppin State University, Ms. Phaedra Stewart from LifeBridge Health, Mr. Greg Brown from the Land of Kush, and Ms. Rocky Herbroken from Unite Here for joining us today and sharing their experience, their expertise. We will begin with Jason Perkins Cohen. Do you want to begin with any?
Thank you, Councilwoman and members of the council and the audience. Again, my name is Jason Perkins Cohen. I'm the director of the Mayor's Office of Employment Development. I want to thank the Councilwoman for her opening remarks, and we agree completely. You have our written testimony. I would just echo the challenges that you laid out. We have 15% of our population in the city of Baltimore over the age of 25 that does not have their high school diploma. I mean, I should just pause and say, obviously we could talk all night about the challenges. I'm not gonna talk all night, but I'll just lay out a few. 15% don't have a high school diploma, and as you mentioned, national estimates say that 1 in 3 Americans have a criminal background. There is no data on any city's information. It's not collected in the census. But if it's 1 in 3 Americans, then you would expect it to be that in Baltimore City or higher. And then we know things about access to child care, access to transportation. But just taking criminal background and education and thinking about jobs and job availability and how many jobs, just virtually every job has an educational requirement, and how many of those jobs that are considered good jobs in terms of just the wages that they pay require something, a high school diploma or better. How many jobs that are, quote, good jobs based on the wage that they pay do not allow someone with a criminal background, do not allow someone who has a felony conviction access to those jobs. So right off the bat, if you're someone who does not have a high school diploma, 15% of our population, that's really large. Someone who has a criminal background, you are really restricted in terms of the jobs that are available to you that you can even go for. Again, I could go into a lot more detail about other barriers, but I'll just talk a little bit about what we do at the Mayor's Office of Employment Development just in a minute or so. Certainly happy to answer more questions. We have workforce centers across the city. We have 2 large centers, one on the east side and one on the west, and then we have several satellite centers. And then in a newer model, we have community job hubs, in which we send staff to a community-based organization to provide employment services. So what we're trying to do in a broad sense at MOED is we're trying to actually bring coordination to the workforce system, not just focusing on what the city does with people who happen to come into our centers, but there are a lot of organizations around the city that are providing really good quality services, and residents shouldn't have to try and figure out how to navigate which service to seek and figure out how to address all their challenges by going through that web. So we're trying to bring organizations together so that it makes it easier and it's more transparent for residents and from employers who don't want to get calls every time they have a job opening from many, many organizations trying to suggest their people for the job. So we're trying to build that network. We're trying to make sure that it's easier. We're trying to create access points so that as a resident comes to us, they have access not just to services that the city provides, but services that are available in the community that they can, again, go through their path. The other thing we're trying to do on the employer side is, as you know, the other customer for MOD in addition to the residents is our employers. We're trying to be a matchmaker of sorts, where we're matching residents to available jobs. And we have, one of our strategies is something called industry sector partnerships. So we're bringing industry together that is in the same industry. We're trying to figure out what their needs are. We're trying to have them tell us what their needs are. And then we're trying to adjust services to fit those needs. We don't want to be involved in a train and pray model. We want to make sure that to the extent that we're funding training, we're training for jobs that are really there and jobs that are on a career pathway. And then just briefly on the youth services side, we obviously also have youth services. We have 2 centers also. These are separate centers than the ones I mentioned previously. They're youth opportunity centers. One is on the east side, one is on the west side. Again, much like our adult centers, the youth centers are open to all comers as long as you're under the age of 24. And again, what we try and do is we try and provide all of those wraparound services and access to training and access to jobs. So on the training side, we initiate grants with our federal dollars to organizations that are providing industry-recognized occupational credential. It's a RFP process, so there's a panel that selects those providers. And in addition to that, of course, there's also YouthWorks, that is our summer jobs program that I'm also happy to talk about, but I'll leave
Thank
that
you.
unless you all have questions.
Nope,
So I'll
that-
just stop there because I know you have other people to talk, but I'm happy to
Perfect.
answer questions.
Thank you, thank you. I just want to acknowledge that from the Council President's office, Kaylin Young is here, and then Councilman Robert Stokes from the 12th District, who's a part of the committee, is here as well. Next, I'm just going to bring up, so we can go right through and we'll ask the questions later, is Roxy from Unite here.
Thank you. Good afternoon, Councilwoman Sneed and Councilman Pinkett. Thank you for holding this hearing. I was really interested and enjoyed reading the report that was issued prior to the hearing. So Unite here is the Hospitality Workers Union. We represent about 300,000 workers throughout the United States and Canada. Here in Baltimore, oh, excuse me, Councilman Stokes, I'm sorry. I didn't see you there. How are you? We represent about 3,000 men and women here in Baltimore City that work for about 23 employers, including Hyatt, Hilton, Marriott, Camden Yards, cafeterias at Morgan State University, Hopkins, and Coppin are some of them. Thank you for holding this hearing on such an important issue to our city, which is jobs. Over my career as a union organizer, I have seen the effect that having a good job can have on an individual and on a family. And the connection between stress, hypertension, and poverty is well documented. What I've seen is when workers win for the first time a collective bargaining agreement that provides job security, employer-subsidized health insurance, decent wages, increases every year, retirement plan, people go from feeling scared and nervous to proud and confident because they have the resources to take care of themselves and their families. In the report that was issued for this hearing, the category of accommodations and food, I think best captures the workers that we represent. And that category, accommodations and food, there's a wide spectrum of jobs, from a part-time dishwasher at a small private restaurant making $11 an hour to a banquet server who works for one of the largest corporations in the world making $60,000 a year. What we see a lot in the service industry is, and in the accommodations and food industry, is people jumping around a lot, working multiple jobs, because maybe they can't count on the one job they have due to its seasonal nature or just its low wages. So we've adopted a campaign called One Job Should Be Enough, because what we see with people in the hospitality industry is because they have to piece together 2 or 3 jobs, they might be working 70 or 80 hours a week and not getting any benefits because it's not at one employer. And not only does that create a lot of stress for them, it creates a lot of stress on the family. The report talks about opportunity youth, and I couldn't help but thinking some of these opportunity youth are the children of hospitality workers because their parents can't be home that much because they're out trying to make ends meet. So the low wages don't just affect those individuals, it affects their families, and I think does feed into sort of a cycle of poverty. But if folks then don't, complete their education. So I think this notion that creating good jobs is a key to many, many of the ills we have in our city is really important. There were a lot of very good recommendations in the report. I think there's 2 points that Unite here can contribute to this very important discussion. One is that where workers have a union, wages, benefits, and rights are higher than the non-union jobs. Union employees make on average 30% more than non-union workers, where 92% of union workers will have health-related subsidized health insurance from their employers. That is on the non-union side, 68%. Union workers are more likely to have pensions and health care. One thing we negotiate in our contracts is to maximize full-time work. So an employer won't take a schedule of work and create many part-time jobs, but create as many full-time jobs as possible with benefits, with pension. So it's very, very important. This year in Baltimore City, the lowest paid union hotel worker will go to $15 an hour. That's the lowest wage, like a dishwasher or steward. On some of the campuses, like Hopkins, the lowest wage is now at $16.40 an hour and goes up every year. So we know that through collective bargaining, we can push wages up. Good union jobs aren't just good for the workers in the union, they're good for non-union workers too. Studies have shown that where wages rise because of unionized workers, all the wages in the industry rise. We saw this recently. The union organized some workers at the Marriott Corporation, the Marriott Waterfront, and when we won the union, Marriott raised the wages of all of its employees, union and non-union. So that pressure does help the entire community. The value of these higher wages is not just for those particular workers that receive the higher wages, but it helps the whole community. One thing that the study cited is the large number of small businesses with black ownership in Baltimore and how they don't capture that large of a percentage of the overall revenues. But if workers make more wages, they're going to come to their neighborhoods and they're going to spend money. They're going to go to the corner store, the hairdresser, the takeout down the street, and they'll also be able to spend money on tithes at their church, paying for school field trips, scouts, Girl Scouts, Boy Scouts, sports. So by raising wages, either through collective bargaining or minimum wage, what we're going to see is that is a mechanism to have wages stay, have money stay in our community, so that companies don't make the money and send it somewhere else, but it stays right here in Baltimore and helps fuel our local economy. That brings me to my second point. Baltimore City, we believe, needs to make developers pay their fair share towards the betterment of our city. I'm referring to the record amounts of money gifted to developers in the form of tax increment financing, TIFs, pilots, and deferred taxes. The same Marriott Waterfront Hotel I referenced has paid only $1 a year in taxes for the last 19 years. Had it been paying its legally required amount, that would have been $47 million more in the city coffers. The Sagamore development and Harbor East saw a record $660 million bond deal. But with that deal came no requirements with standards for jobs. No local hiring requirement, no job standards, no other employment-related guarantees. Developers always claim that they are worthy of public tax subsidies because they will create good-paying jobs. What we have seen in the hotel industry is that that is not always the case. Specifically, when we organized at the Hyatt and the Marriott, both companies received tremendous amount of public subsidies, but the jobs were not that good. And not only was it that the particular jobs weren't good, the employers relied heavily on temporary agency employees. So someone that could come and apply for a job at the hotel directly, they may be told, look, you're not qualified. You don't have the education requirements. You don't have the background. But they could get hired by the temporary agency, come to that same hotel, do that same job for less money and no benefits. So that's an area that it seems kind of hypocritical because the people do come there and work just for lower wages. So I think when we are in those situations where developers are beneficiaries of subsidies through the public arena, we should require standards. The report requires does say that there is a need to tie public subsidies to job standards, and we strongly endorse that both for local hiring and for job standards. So that concludes my remarks. Those are the two recommendations we have. I just want to say also the union has just started a training and education fund, 5 cents an hour that many of the employers are paying, and that money is specifically going to be to try to connect the good union jobs with the neighborhoods that need it most. So I expect that we'll be working, as that money builds up, working with the city to try to make that a reality. Again, we're very much interested in local hiring, full-time jobs, and one job should be enough.
Perfect.
Thank you.
Will you be able to stick around for our questions
Sure.
at the end? Perfect.
Yes, thank you.
I'm going to call up Mr. Gregg, if you can, from Land of Kush, small business owner.
Good evening, everyone. How's everyone doing this evening?
Good.
Good to
State
see you.
your name for the record. We're being recorded.
Sure. My name is Greg Brown. I own a restaurant called the Land of Kush, vegan soul food restaurant. We've been open for 9 years and looking to open a second location here in Baltimore in the Councilwoman's District. And so from a business owner perspective, there are several things that intertwine with labor in the city and getting people good jobs. And the first thing is education. I think you mentioned the rate of or percentage of people who don't have GEDs, and I just experienced that. I had a young man working for me who is 25, 26, going on 26 years old and does not have a GED. And that's a very real thing. Very smart young man, but does not have a GED and cannot further himself beyond where he is. So I think education is a big key, and I think how we intertwine job training with the school system is a very vital thing. It's very important because many of these children may not go to college. So these skills to get a job and to be to some sort of workforce development while they're in school is a very vital thing, to let them know that they, number one, you have to come out of school and hit the ground running, but also the opportunities that are out there. And I'm not only speaking from the perspective of being a small business owner, but I also sit on the board for Visit Baltimore's foundation, which provides training and education in the hospitality industry. But there's a very real opportunity to get people jobs within that industry. It's just an opportunity for people to push forward. And I think there's an individual that maybe some of you know, Damian Cooper, who came through that system of the hotel, who started off at the very base level and ended up building hotels or helping to build hotels across the globe. This is someone who grew up in Murphy Homes, and I don't want to speak on his life for him, but this is what he's, kind of shared with me, is that he came from the projects and worked his way up. And I think that's a very real thing for people to have the opportunity to do if they have the hunger and desire to do so. But education is the vital thing. Intertwining training with education, very real life training, so that they can go and work actual jobs and earn money and build up those actual skills. And then providing additional training. Let's say you're out of school, some sort of free coursework where they can get additional training, customer service training. I'm an advocate for life skills training. What I really see with many of the youth that come through is they do not have financial literacy. They do not know how to budget their money. They do not know these things when they come out of school. I know it wasn't taught when I was in school, but it is a vital thing, because if they cannot manage the money that they have, you can give them $15 an hour, you can give them $17 an hour, but if they go and blow it at the casino, that's just a whole nother thing. So it's just money management. And I'm not downplaying the casino per se, but you have to have disposable income. So many times I find myself coaching, as an entrepreneur, I'm not speaking to them just as an entrepreneur. We're not here just to do work, but I'm giving life skills. My wife is giving social skills, how to communicate with others, how to work as a team. These are things that need to be integrated in the education system so that they understand, very real life, how to use these skills so they can refer back to them when they get out into the workforce. Intertwining social services with entrepreneurship. And any job that they have, there has to be a link between social services and the jobs that they have. There has to be resources. Many people, whether they're a demographic that we come across, are single mothers. Sometimes they have access to social services, but there are many other resources that they do not know about in terms of furthering their education, in terms of just doing research, in terms of managing their relationships. A very big thing is how to, just part of the discussion that we just had with a young lady is managing her personal relationship. These are, and I know it may not seem like it does not pertain to labor, but it absolutely does, because when you understand how to manage your personal life, you can go out and achieve certain things because you have a clearer mind state. You have a better base lifestyle to go by. The other piece is mental health. Is a lot that we deal with. Is just being able to maintain, I come from a background of yoga and exercise and health and nutrition, so we're spending our time educating the people that come through our establishment on these things. And so mental health and learning how to deal with the emotional crisis that they have to deal with. These are all things that can lead to better lifestyles that allow them to take advantage of some of these jobs that are out there. So we need the training. We need the education. The education is so key. How do we integrate job training into the schools? And there are some schools that do a good job. I know we work with Mervo, and we have some of their students come in, and myself and my wife, we go and speak to some of the schools. We speak to high schoolers. We speak to elementary youth. We speak to middle schoolers. But how do we integrate the education with the training? And then once they get out of school, their services cannot end. How do we integrate social services with the jobs? It's not just, what I find is that social services are completely separate from the land of Kush. However, that should not be the case. There should be a direct link between social services, education, and training with these small businesses, because we're the ones in contact with the baseline people that are out here, the ones that don't have the GED and the high school diplomas, the ones that, they just don't know. They just don't have a clue. So how do we intertwine and make a strong, positive network so that we can build up people and show them the opportunity? I think many of the issues that we have in terms of crime, in terms of the labor, is due to lack of knowledge of resources. So how do we make those connections? And I don't claim to have the solutions or all the solutions, but I see there's a disconnect between the services, resources that are out there, the education and training with the jobs, and there has to be that direct link so we can point people in the directions and be more of a support system as much as a business opportunity for the people and the citizens of Baltimore. So,
Thank you.
thank you.
You'll be able to stick around for questions.
absolutely.
Perfect. You asked a number of questions, so I'm going to bring up Melanie Hood Wilson to, because I think you can address some of the questions that when he talked about services and connecting folks.
Good evening. My name is Melanie Hood Wilson. I have 18 years experience in workforce development, previously at the Community College of Baltimore County and currently as an educational consultant. And it's funny that training came up during the last speaker, because I want to talk about that today. My thesis is that we will not be able to have the employment rates in Baltimore City that we need to be able to have the tax base that we need to be able to have employed citizens who are contributing, and also to be able to avoid these cycles of crime and violence until we have proper training for individuals. There are two cycles that I see that come with that lack of training. First of all, it's difficult for people to become employed, so there is higher unemployment. That higher unemployment often leads to a certain desperation that we see all across Baltimore, that then leads to lack of safety, leads to crime, leads to violence. But the other cycle is that when we don't have proper training, and then because of such, we have high unemployment rates, we are unable to develop the tax base that we need as a city to be able to provide a host of services, but most importantly for me, among those, would be adequate public education funding at the local level. And without that adequate public education funding at the local level, we have higher rates of unemployment. And so the cycle continues and continues. There was a study that was done called Broken Pathways by the Fund for Educational Excellence, but in that study, some data was cited as to the reading and math levels of 11th graders in 2017 in Baltimore City. What that data showed was that 56% of 11th graders who tested that year, 2017, were reading at or below 5th grade level. And 54.3% of 11th graders taking that iReady test were reading at or below, were performing math at or below the 5th grade level. We know that we have between 14 and 17% of the students in our public schools during any given year receiving special education services, which means that they have diagnosed disabilities that impact learning in one way or another. Jason Perkins Cohen pointed out that there's about a 50% rate of people who are not able to complete high school. When you look at these barriers that the lack of education, the barriers that disability create, the barriers that low literacy and low numeracy create, it creates a very dismal outlook for employment for Baltimore City. We spend a lot of time in this city talking about how to improve our public education system, and that's valid. We need to put effort and funding behind that. But we have hundreds of thousands of Baltimoreans who have already exited the public school system reading and performing math at or below that 5th grade level. And if the fixes that we're talking about and focusing on as a city are squarely centered on public education, that means that the horse has left the barn for these people and we are leaving them for dead. And that's not how it needs to be. There are some myths that exist around workforce development training and around employment for adults. There's a whole idea that if you learn a skill, you can keep a job. As long as you learn how to do that pipe fitting, or as long as you gain those carpentry skills, you'll keep that job. You'll be fine for the rest of your life. That's not true. There's the myth that blue-collar jobs are easy to come by. I can't tell you how many times on political Facebook groups or neighborhood Facebook groups, I've heard people dismiss the unemployment rate in Baltimore by saying, but look at all the construction that's going on. So Sagamore is doing this, or there's this new development in Harbor East. Why can't people just go and get those jobs? Those jobs require some training. I can't walk in off of the street and plumb a new building. There are skills that I need in order to be able to do that. There's the idea that on-the-job training is enough, and that's not true, and I'll get to that in just a moment. And then there's also the myth that people with low literacy and low numeracy are simply unintelligent and unemployable. And there is a lot of data nationally, and there are models of training that prove that that is absolutely untrue. We have a lack of training options in Baltimore, and that's really at the heart of our issue. There are some wonderful programs that exist. There are programs that exist through nonprofits. There are a host of services that exist through Baltimore's Promise. There are community colleges in the area that present training options. The problem is when you have so many Baltimoreans who have low rates of literacy and numeracy, or low levels, pardon me, of literacy and numeracy. So many folks who have diagnosed or undiagnosed disabilities or failed to complete high school, those training options become very limited. I had a meeting to discuss these issues with Baltimore's Promise back in the fall, and what I was told was that most of the training options that they offer through their partners either require a 6th to 8th grade reading level, or, and it applies to most of them, are trying to increase that threshold to a 9th grade level. So think of all the Baltimoreans who are left behind by that. Where do those people go for training? There are 3 types of training that I think are really important. First of all, there's essential skills. So going back to the idea that learning how to do the job is enough to be able to keep the job. That's untrue. Most people who lose their jobs lose them because they are not able to adapt to the workplace, not because they don't know how to do the skills the job requires. It's things like attendance and punctuality, conflict resolution skills, understanding workforce appropriateness, what's appropriate in this workplace versus that workplace. Also, understanding how to overcome specific barriers to employment, like childcare issues, or in Baltimore City, transportation issues, knowing how to develop strategies to overcome those specific barriers. That's all a set of training that most people don't get before they enter the workforce. And so even if that unemployed person becomes employed, they're likely to become unemployed again because they lack those essential skills. Another type of training that's really desperately needed, and while there are lots of jobs that you can learn, by entering, there's a lack of training for specific skills that employers are looking for. So going back to the idea that to work in certain industries, there are certain skill sets that you may need coming in. You're much more employable and you have much more of a fighting chance if you've had some training in those areas. And the best way to do that is to have some entity that is working specifically with those employers on a model that actually the Build uses in their Turnaround Tuesdays to communicate with the employers to find out what are you looking for in your new hire, and then teaching specifically those skills that this specific company that Johns Hopkins is looking for in their new hires. The third type is pathways training. We have a lot of programs that help people to, and we've talked about this a lot in this hearing, to acquire employment in fields that don't pay very much, may not be very pleasant. It's a great way to get something on your resume and to get employed and to start paying your bills, but it's not a long-term solution. It's not something that anyone in this room would really want for a long-term solution. So we need to start identifying pathways in Baltimore and in Central Maryland that require that someone with low literacy or low numeracy or a disability or lack of high school diploma can enter and prosper in and move through a career pathway to acquire more education in that area so that they can move up through the ranks to acquire, to get more money, to get promotions, etc. Let's see. There's a need for centralization. We do have a wealth of resources in Baltimore City. But I'll tell you, as a Baltimorean who has worked in workforce development, has a master's degree and a family, and is a professional, I wouldn't know how to find all of what's out there in Baltimore in terms of training programs. Things need to be more centralized. We have a dynamic office in MOED. These things really should be funneled a little more through our public agencies so that if I'm coming in as, I'll say, a consumer, as a member of the public looking for training, there is that one stop that markets all of the various types of training for me, and also can tell me, well, since you are a person with a college degree, let's look at this for you. But since you are a person who is reading at a 5th grade level, and you're performing math at a 4th grade level, you're gonna need more supports. Here's what we have for you. There's a menu of options for this person, a menu of options for that person, each with different backgrounds. The need for funding. I can't tell you how sad it is every conversation I have with a public official, and I've had 3 or 4 at this point, about these needs. And what I hear each time is that there really isn't the public funding that's available for that. We have to put funding behind training. And if there's one thing that you take away from what I'm saying to you this evening, that is it. We have to have funding. In order to bring training partners, quality training partners especially, to the table, we have to be able to pay them. Teachers don't work for free. Books and materials are not free. And then finally, the need for training partners. There are some wonderful organizations doing great work out there and who are specifically capable of working with populations with these specific barriers that I'm talking about. We need to identify them and include them in these solutions. I'm thinking about Division of Rehabilitation Services with the state of Maryland. They have a wonderful facility, Workforce Technology Center, on Argonne Drive in Baltimore City that serves the entire state. They, I think, are a wonderful option to be part of the solution for some of our individuals in Baltimore who are experiencing the barriers around disability, and probably a number who are experiencing barriers around low literacy and numeracy who may not have been diagnosed with disabilities in the past. At Build, I've had the pleasure of going to a couple of their Turnaround Tuesday sessions where they are really meeting community members where they are, providing essential skills training once a week, and then going deeper with them in terms of pathway training. We need more of that. We need more partners who understand how to work with diverse populations and are not looking for the cream of the crop. Just those who are going to have the best outcomes because they're reading or performing math at high school level or above. The Kerwin Commission, I understand, has funding that will be, once it's all adopted, available for workforce development. Hopefully that will be an option that we'll be able to explore in Baltimore, but we need to do some real brainstorming around how we develop the funding to give our citizens what they need for training, because we're not going to have employed citizens until we have better training. That's it for me.
Thank you. You'll be able to stay around so we can ask. Okay. Dr. Lucas is next.
A little short. Good evening, everyone. I'm Dr. Tamira Lucas. I'm the Executive Director of the Warnock Foundation, as well as Assistant Professor at Coppin State University. So a lot of what I'm going to talk about has kind of already been discussed, but still going to reiterate a lot of the things. So throughout decades in Baltimore City, statistics have shown that more than half of the households in Baltimore City are single mothers living below the poverty level. Households in Baltimore City have a median annual income of $51,000, which is less than the median annual income of $61,937 across the entire United States. According to the report by the National Women's Business Council, access to capital remains one of the most significant barriers for women to launch, scale, and grow their businesses. Research has shown that men tend to start their businesses with nearly twice as much financial capital than women. According to the Institute for Women's Policy Research, men are more likely to receive startup funding from venture capitalists, angel investors, and financial institutions. At the same time, women are more likely to use their credit, take out home equity loans and their names, or rely on family and friends. In Baltimore, this is impossible because minority women who are the head of households lack the financial education, credit, home ownership, financial resources, support, childcare, and overall knowledge to even leverage for business ownership. Charm City has many of the same challenges that other large urban areas across the country face. Gentrification, income inequality, and other issues have caused turbulence in cities and city areas, particularly among minority citizens. Yet, Baltimore continues to cultivate several Black entrepreneurs, innovators, and leaders, successes forged by the challenges that they have overcome. While women entrepreneurs create new businesses, disrupt established industries, and develop innovative products at a record pace, they still face institutional barriers to starting a business that makes financial parity and male entrepreneurs a challenge. The 2017 Institute for the Future for Dow Technologies report, The Next Era of Human-Machine Partnerships, Emerging Technologies, Impact on Society and Work in 2030, indicates that 85% of the available jobs in 10 years have not been invented. It is also projected that 375 million jobs worldwide will vanish during the same time period. Job losses of up to 47% within the next 50 years, and a loss of 1.4 million jobs in the United States in just 8 years. U.S. jobs losses are also being driven by a reality that 48 billion hours of work a year will soon be done by robots. Technologies such as artificial intelligence are grounded in data science and changing how we organize and pursue sustainability. Current and potential technology-based businesses in Baltimore cannot attract qualified talent to fill such positions due to the lack of talent. These positions do not require degrees, but require certifications. According to the report by the Able Foundation, throughout Baltimore, men and women from young adults to older workers are seeking meaningful employment opportunities that offer family-sustaining wages and support personal well-being. Labor markets are tight, meaning that skilled workers are in great demand, and a unique prospect exists to open doors to quality jobs, particularly for those who face intractable barriers to such opportunity. For this reason, it is now imperative to consider rapid expansion of high-quality workforce development programs to assist job seekers obtain the skills they need. While Baltimore's industry sector workforce programs are helping to make an impact, their combined capacity is not at scale needed to serve the large number of residents seeking career-oriented employment and the many employers looking for ready workforce. While there are workforce development programs that focus on training Baltimore residents living wage jobs, there are still several barriers that prevent the largest population of households from attaining the training and ultimately the jobs. Access to affordable childcare, access to transportation, access to affordable housing. Baltimore City will never be a thriving city in the workforce and business if residents continue to be unemployed or underemployed, if small businesses continue to fail due to the lack of financial support, if workforce development programs aren't created to address the current and future technology job markets, if many issues single moms face who are cultivating the next generation are not addressed, if alternative solutions to transportation barriers are not provided, and if chronic literacy issues families are experiencing are not adequately addressed. It is extremely hard for families, especially single mothers, to obtain necessary training to start their businesses or obtain training for employment if they are unable to read. According to a report from Baltimore Workforce Funders Collaborative, in Baltimore, 1 in 5 adults lack high school diplomas. Approximately half of neighborhoods are classified as high incarceration communities, and exposure to traumatizing experiences have had deep impacts on so many adults and youth. Workforce development actors are hard pressed to serve many who are in need. While some attempts to address these issues have been made through the development of academic bridge programs and the practice of referring people to other types of service providers, the scale and complexity of this problem is still difficult to attack and demands significant attention. We cannot expect individuals to enroll in a program where they are unable to read the paperwork to sign up. Addressing workforce issues is not a one-dimensional issue, but it's multi-layers of issues that impact the entire process of obtaining a job or creating a job. The capabilities of our residents should not be limited based on the barriers that are affected by, but instead remove those barriers. So there are 2 recommendations that I have. Recommendation number 1, implement programming to support small businesses. Small businesses drive economic impact in our community, and while single mothers are head of households in our communities, there must be a focus on increasing access to entrepreneurship opportunities to help families increase household incomes above the poverty level, ultimately increasing generational wealth. Increasing these opportunities will eventually increase job opportunities within the communities. Provide additional funding for the Women's Business Center. Implementing a Women's Business Center in Baltimore City that addresses financial and business education along with wraparound services and access to capital, especially working capital. Women business centers help women entrepreneurs overcome the unique challenges facing women-owned businesses. Create a small business fund for human capital. A small business fund should be established in order for small businesses to access financial resources for human capital. This fund should provide financial support to allow small business owners to train staff and retain them properly. Human capital drives the success of small businesses, which can alleviate chronic poverty in our communities. And then incentivize small business owners to employ the community, have an incentivized small business owners to employ the community program. Work where you live programs should be established, and small businesses should provide local tax benefits for employing individuals in the community. Recommendation number 2, increase workforce development programs that are STEM focused with trauma-informed services. Living in poverty for decades is a traumatic and stressful experience that is often overlooked and not addressed. Providing services that help overcome such barriers can help create mental stability job seekers need. Creating a talent pool will attract businesses in Baltimore. That ends my remarks.
Thank you. You'll be able to stick around so we can ask you. Perfect. And last on the list is Phaedra Stewart. And just restate your name since they're recording.
Okay, thank you. Good evening, everyone. My name is Phaedra Stewart, and I am one of the Vice Presidents of Human Resources at LifeBridge Health. As you're aware, probably, LifeBridge Health has Sinai Hospital, which is located in West Baltimore, Grace Medical Center, formerly Bon Secours Hospital, which is also in West Baltimore, and then Levendale Geriatric Facility, which is located in the West Baltimore area as well. Communities near our campuses have particularly high rates of unemployment, which is one of the key factors in the social determinants of health and a driving force in health disparities. This is why we are really focusing on workforce development, and we're trying to make sure that we are continuing to grow in this area. I do want to thank the speakers who came before me, because I think they very eloquently laid out all of the disparities and the barriers that people have to employment. I don't want to repeat those, but I'd like to talk about some of the things that we are doing at LifeBridge Health to try and overcome those things. We probably have hundreds of openings throughout LifeBridge Health, and we are constantly striving to identify qualified candidates as well as retain persons who come through our doors. And we really have a two-prong approach. We're trying to create a pipeline of qualified candidates to bring in, and then once we bring persons in, we want to make sure that we're providing them with the support that's necessary to maintain employment. A few of the things that we've done probably over the past year, year and a half, because of the number of persons throughout the Baltimore area who do not have high school diplomas or GEDs, we've actually removed our high school diploma requirement for our frontline positions. Understanding that we may have to provide some support and training and development when they come in the door, we have a school at work program where we actually provide persons with grammar skills, writing skills, reading skills, essential skills, which is very important. I will admit a lot of our employees lose employment because of the essential skills, not their inability to actually perform the duties of the job. So we're trying to make sure that we are providing those essential skills for employees once they come in the door, even if they don't have the high school diploma. We're also trying to encourage them to get the high school diploma once we employ them, and that's a development opportunity for them to move into higher level positions. We have increased our hourly rate, our base hourly rate for all employees within our hospitals to $13 an hour. We don't have positions where you come in lower than $13 an hour. We started at 12 last year, and we just recently, effective January 1, increased that to $13 an hour. We are also trying to ensure that we are starting at the lowest level possible, so we are creating a partnership with Pimlico Elementary Middle School. We're trying to get students interested in healthcare careers. We're providing support to the students at Pimlico Elementary School, and we have been working with Baltimore City Public Schools over the last probably year to develop a program, as well as the principal there, and we are kicking off a program where we will have speakers going to the school, we will have tours of the hospital, and really try to encourage students to have a love of healthcare careers very early. During the summer, we do hire students from YouthWorks, Baltimore City YouthWorks. Formerly, the Hire One program, we have students from that program as well. In addition, we are working on a partnership with Green Street Academy because the healthcare industry is not just about patient care. We're a business. We have positions in finance. We have construction positions. We have human resources positions, and we're really trying to educate the general public on all of the opportunities within healthcare, and one of those opportunities is skilled trades. So we are creating a partnership with Green Street Academy to bring students into a skilled trades program, again, through the Baltimore YouthWorks program. I did forget to mention our YouthWorks program that we currently have. We partner with the Baltimore Alliance for Careers in Healthcare in that regard. So they help us to identify the students who come into our hospitals through YouthWorks. Does that make sense? Okay. In addition, if you are familiar with Cristo Rey High School in Baltimore, we have a partnership with Cristo Rey as well, and we employ Cristo Rey students at each of our facilities, with the exception of Westminster, only because of the distance that students would have to travel in order to get there. So those are some of the things we're doing with regards to a pipeline. Once you come into the organization, we have a department within LifeBridge Health called VSP. VSP doesn't stand for anything. Most people think it stands for something, but it doesn't. We just call it VSP. But they are really the vocational arm of our organization. They help persons with disabilities to become gainfully employed, and they have case management services where they actually follow those persons through the course of their employment to make sure that they have the support that they need, and they have a person to help intervene when there are issues, whether it's employment related, personally related, and those kinds of things. What we've done recently is VSP is now partnering with our workforce development team, and we have persons who have come into dietary services, environmental services, all of those kinds of areas, those frontline employees, and we are now helping them with those essential skills during the first 6 months of their employment, and then the second 6 months of their employment, we are providing them with those case management services as well. So we're really trying to make sure that we grab them early on, give them the attention that they need, help them with the essential skills, help them with communication and all of those types of things. So at the end of that first year, we can send them out and they can thrive on their own. If they still need support, we offer wraparound services, but that's really the goal of that partnership between VSP and Workforce Development. We also have career coaches, we call them navigators, on staff. So anybody within our organization who earns $15 or less, they have the services of a navigator to help them to plan out, where do you want to go in the next 2 years, the next 3 years, the next 5 years? How do we help you to get there? Here are the educational dollars that are available to you through the organization, and how do we really help you to map out a plan so that we are developing you into the career that you really want to go into? We also have a program called the Kuji Chagalia program. Persons who work for the Kuji Chagalia Center, they actually intervene when we have persons who come into our emergency department through violence-related acts. So when we are notified that there's a person who may be in an ED through stabbing, a shooting, those kinds of things, there are members from the Kuji Chagalia Center who come in and they function as, again, case managers to identify where are the barriers, what's going on in your life, and they really try to help them to get on track, figure out what are your employment goals, what are your educational needs, and all of those things. And we actually get grant dollars to help persons in those programs to advance and really do whatever it is that they want to do in life. So, I'm sorry, we also have computer training, and we have opened our computer training classes up to the communities around our facilities. So we have kind of a schedule similar to a college. So we have a fall schedule of classes and a spring schedule of classes. We send those schedules out to Park Heights Renaissance and all of the different community organizations around our facilities, and we invite members of the community to partake in those classes as well. And then someone mentioned financial literacy. We actually partner with, I believe it's called the Cash Maryland or Cash Operations, Cash Campaign, thank you. And they actually come in as well and provide financial literacy programs for our employees, because I completely agree, I'm not sure who said it, but you can give a person all the money in the world, but if they don't know how to manage those dollars, that becomes a barrier as well. So we're trying to make sure that all of our employees have access to financial literacy. So those are a few of the initiatives and strategies that we have underway. LifeBridge Health is pleased to be a leader in the community, or at least we think we are. And we are just trying to build partnerships with local community organizations so that we can continue to increase what we're doing for employees, and again, creating that pipeline. Because, we are providing health care, and without quality staff, quality employees, we can't provide the type of health care that is needed in the community.
Wow.
Thank you.
That was good. Just to hear about what you're doing to break barriers. Stand there for a moment, because we're just going to start.
Sure.
Hi, Director. Do you want to add anything? No. Okay, you missed some good testimonies here. But I just want to start, we'll just go right into questioning, and we'll start with you.
Sure.
I just want to know, when you guys decided to remove high school diplomas, what was the conversation like with senior staff in the building saying, no, we can't do this, or was it even a fight?
So interestingly, it was one of our members of our executive leadership team that proposed it. When we really start to look at bona fide job requirements and whether or not a high school diploma is really necessary to perform some of those frontline functions, we realized it wasn't. We can bring people in, we can train them to perform those duties. Again, we've got to couple those essential skills with the actual, the routine duties and responsibilities that are required, but we didn't need the high school diploma or the GED in order to bring people in to truly get the job done that we were hiring them to do. So there was no big fight with executive leadership. We proposed it, and within probably about a 2 to 3 week time frame, we were able to get it approved.
Wow.
Yep.
And is there additional cost to doing it that way that that LifeBridge had to incur because of this?
So again, there is probably more time spent on the essential skills piece and the case management, but we already had departments in place that did that type of work. We just increased the volume for those departments. As we continue to bring employees in, we may need to increase the staff in those departments to meet those needs, but generally not an increased cost at this time.
And so, switching gears, because of what you guys have done and what you've now seen, what do you think, what are the jobs within LifeBridge that are expected to see the most growth probably in the next 5 years?
That one is probably difficult to answer. We are hoping that, again, for all of those frontline positions, we'll be able to bring more people in, create that pipeline, and then as we skill people up to advance and move into higher level positions, it will just create that constant wheel and that constant churn of bringing people in, skilling them up, they move into higher level positions, and then backfilling.
And what, can you talk about the demographics? I'm just wondering, because you talked about the community and what the makeup is. Is it the majority still Black and?
Yes, so Sinai Hospital and Levendale, we are in the Park Heights community, below Northern Parkway. And of course, Grace Medical Center, formerly Bon Secours, is located off of Martin Luther King Boulevard on West Baltimore Street. So the primary population in both of those areas, yes, it's African American.
Perfect. Colleagues, do you have any questions for Ms. Phaedra? No. Thank you.
Thank you.
Yes. Who are you starting with? Yeah.
Thank you, Madam Chair. My questions are for Jason Perkins-Cohen. I'm not sure what the limit is. I do have 2 questions, but can I just ask him a technical question first? Jason, I see a lot of statistics as it relates to unemployment, and they're enough to cause us angst as it relates to these particular numbers. But do you also measure the discouraged workers as well? And if you, in case nobody else knows what.
Yeah, so we all have heard of the official unemployment rate that is calculated by the Department of Labor and has very specific definition, and that's in my testimony about what is counted towards someone who's actively seeking work and what is not. The Baltimore City unemployment rate as of December 2019 is actually as low as 4.2%. I would just caution that is not, and that's not measured by MOAD, that's measured by the federal government. That's not seasonally adjusted, so it was about 5.5, 5.6 in July of 19, so we would expect it to bump up early this year. December is the latest information available. The problem with the unemployment insurance rate, Councilman Pickett, which is what you're getting at, is discouraged workers are generally not measured or not included in the measurement. And it's very hard to know the numbers of discouraged workers, and there's lots of studies that try to estimate it. Some folks would say, you might double the unemployment rate as a ballpark for the percentage of discouraged, or the true unemployment rate of a city, which would put our employment rate closer to 10%. But it's not something that we can measure.
Okay. With one of the previous testimonies, it appears that the majority of the funding for workforce training comes from either the federal government or philanthropic sources. Can you speak to what appears to be an aversion for local government to contribute more or to invest more in workforce development?
Well,
I'm not trying to put you on the spot, but I mean, I think we as the council need to know, when in preparation for budget cycles so that we can adequately respond to the budget.
Yeah. So as the director of the city's employment office, obviously we strongly support training. I would agree with the previous speakers about the need for additional resources for training. We take the dollars that we have and we put what we can out into the community. We use federal resources to fund youth-related training. We have a program called Grads to Careers that our previous testimony referred to as Baltimore's Promise, but actually MOAD is the implementing partner of Grads to Careers, which goes into high schools and tries to attach graduating high school seniors not going to college into training. But to your point, there are really very limited local dollars for adult training. There are some dollars for youth training, and we use some federal dollars. We have some local dollars that we put in for under 24s, but for adult training, there is no funding pool for local training, and we would certainly think that would be a really positive thing for the city to do, to have a locally funded training fund.
And I'm assuming it's not because you're not asking. It just doesn't get to us.
I'm always going to ask for resources for workforce development. I mean, it goes without saying. And I would say that the challenge with federal dollars, you might think, well, why should local government fund it? Why shouldn't we let the feds fund it? The challenge with federal dollars is that they're not always responsive to local needs. And they often come with strings that make it hard to be responsive to what our residents are telling us that they need. It makes it has us run through certain hoops that we wouldn't necessarily want to run through to provide the best services to residents, and I'm happy to go into more detail.
And lastly, there's also during other testimonies, there was discussion related to the barriers to accessing a lot of the resources. And I know with the Northwest Career Center, we have, what we call a one-stop. But can you speak to the potential for us to co-locate some of these resources, some of these services, to make them more transportation friendly, to make the resources in one place so somebody can access a multitude of resources? And are there models anywhere else that we can look at, that we could bring to Baltimore that might capture, this kind of collaborative setting?
Yeah. So thanks for the question. So I would just note that the 2 one-stop centers, or American Job Centers, as the state would have us call them, at the Northwest Career Center at Mondawmin Mall and our center on East Madison have, by law, and we're happy to do it, have a number of required partners, child support, Veterans Administration, DOORS, and others that are actually physically located in the centers. And then we have non-required partners that we try and invite into the centers, including the cash campaign that was referenced earlier, is at our Northwest Center as well. We're also partnering with the Office of Children to both of us are supporting financial empowerment counselors to get at the point that was made about the importance that it's not just about a job. It's about figuring out what people's goals are and working backwards from that, and recognizing that a lot of it is really about financial empowerment. It's not just about a job. I think the other thing that your question is really getting to, which we're excited about, is this community job hub model. Mm-hmm. That we can put all the partners we want in our centers, and we can try and make them as centrally located as we can, but they have to be located somewhere, and there's going to be parts of our city that are going to have a hard time getting to those locations, no matter where we put them. And so that's why we're trying to go out to the community. That's why our job hub model, I think, makes a lot of sense as a way for the future, where we are basically just taking staff, giving them a laptop, and going to high traffic nonprofit organizations. We could go to faith-based, we can go anywhere. What we want to make sure is we're going to places where there's a need and where there's traffic, foot traffic, so that we can serve residents, and we're attaching ourselves to other organizations that are providing other related services, but we're adding value. I think that is the wave of the future. I think it's a great way for us to touch residents in all of your districts and all corners of the city. It's the lowest cost, most effective method, and we are really excited about the job hub models that really started in earnest of July this year, so we don't really have a lot of data to go on yet, but we think it's better for the residents. They shouldn't have to travel to a community center when, in fact, we can go to their community for them.
Thank you, Madam Chair.
You're welcome. How many do you have?
We currently have 3. When we originally had the job hubs, they're the same hubs, but we had half-time staff, and that was a budget issue. We were able to bump them to full-time staff starting July 1 of this year. The trouble with half-time staff, and aside from the obvious that they're not working all day long, is it was hard for us, as we're an employment agency, we want to maintain high standards for who we employ and in terms of the quality of jobs we're offering. But it was also hard for us to retain the kind of workers we need to do this difficult work.
Anybody want to have questions for Jason?
Mr. Cohen, do you actually look at, when you say you're going out in the community, do you look at communities to see what their unemployment is? Because I have one in my community, and it's like 31%. Are you tracking that information to know exactly where you're going instead of just saying foot traffic? Because it ain't all about foot traffic. It's the data.
Yeah, so what we're doing, again, we're doing more and more with the data that we have. So we're literally mapping every resident that comes to us, we're mapping where they're coming from and trying to figure out where are we not finding residents coming to us where there is high unemployment. And we're drawing a circle around it and then trying to make sure that we're connecting there. And the other way we're doing that, because job hubs, have to be sort of arranged, is that's where we deploy our mobile unit. So our mobile unit visits 2 communities a day. They focus on communities that have the highest unemployment, and so they'll hit 10 communities in a week.
Well, you need to come to Midway.
Okay, I'm ready. We'll connect afterwards.
I just have some comments. The young lady that talked about Turnaround Tuesday do a wonderful job. Turnaround Tuesday, I go there. But I get tired of hearing about people doing studies. Everybody doing a study. Study this, study that. Everybody know what the problem is. You had some great speakers talking about that support system that you need. You can't say you're going to give a person a job and there's a lot of stuff going on at home. We got to work on that part. The other piece is I did not wait for Kerwin to get funded. I brokered a deal with the school system, BCCC, in my office. So Maryville, Emerson, Westside Skills Center will be open in the evenings from 5 to 9. We have expungement. We have life skills there starting in September this year for 4 years. Pre-cyber, pre-construction, printing. We're adding some more things. But that's what we have to do. We can't keep waiting on if Kerwin going to fund this, if it's going to fund that. Kerwin don't feed people. They hungry, and that's why they out there. My other piece, too, is we supported at $15 an hour. Yeah, that was great. That's still poverty. All I'm asking the union is, because when I talk to young black men and women and children of color, they don't know nothing about no apprenticeship. Absolutely nothing. So I'm saying to the unions, the same noise we made about $15 an hour and all the woo-woo noise we made, the unions need to go into these communities and find out what these young people want. And from my experience, they don't want to go to college. The gentleman talked about it. That's why I create the workforce development. So if the school system not providing that support for them, because the ones that want to be a plumber, what are they going to go to the class for 30 minutes and they got to take math, they got to take gym? It don't work. It don't work. So I'm saying to the unions, you do some great things, but you need to go into these communities with Mr. Cohen, where the high unemployment is. I said the unions need to go into these communities like Midway and offer the apprenticeship program. I am now doing a roadshow apprenticeship program. AFL-CIO is going to provide the bus, because from talking to young people, they don't know nothing about all apprenticeships over in Patapsco. They don't know nothing about it. They ain't never heard of it. So it's like it's blind to them. So that's why I created the workforce development. That's why I'm doing the roadshow. But again, and I get frustrated about all these studies. We already know what this problem is. Everybody do a study. We have to take care of our young people in this city. There's a new facility in my district. Down there, I guess they call it a little jail. I'm going to talk to them young men. You know why? Because when they go in there, there is no support system whatsoever. They sit in there, nobody helps them. When they come back out, they go back to the same environment that they left. And until we go inside of these facilities and talk to these young men, because they figure don't nobody love them, don't nobody care, because they still there, no support system, even with the return of citizens. I remember one time when you was in some of the facilities, adults, they had opportunities there. That is absolutely gone. It's gone. So we need to be talking to our Annapolis folks, the governor, to put some money back into this, because if we don't, we're going to come here and have the same conversation, talking about the same thing over and over. There's no support systems in the jails. There's no support system in the schools. We talk about the CTE program. Hold on, let me finish. The CTM program. That was horrible. They said some people graduated from CTE program and made $13,000. That's what should be here. The people that run the CTE program and the EMG program through the fire department. We need to know in those schools, are they working? We don't have them in this room. They need to be here. So if they need some more support to make it work, then we need to help them. But we don't have everybody in this room that need to be here. So I just wanted to share that with you as far as the unions. Y'all do some great things, but we got to do a lot more outreach, and I would be glad to help the unions with that.
So we recently had a job fair. We had about 300 people come. We notified your office also, and it was very helpful. A lot of the city council,
Where was it
reached
at?
out. We had it, it was last week. Yeah.
Camden Yards.
No,
No,
it wasn't just
disrespect.
Camden Yards.
But that
It
people.
wasn't just Camden Yards. We had people, and a number of job offers went out. But I think that a couple of points. It is true that a lot of these positions, people don't need to have GEDs. They can be trained to do those jobs, right? And they have enough support. But it's also true that it takes resources to help give people that kind of support, right? So one of the things that our union is doing is trying to get those resources by having a fund that the employers contribute to. It would be great if there were other resources available in the city to help build that kind of program. I'm not aware of them. Maybe there are. But in terms of the apprenticeship programs, I know that they've been full. So we don't have an apprenticeship program, but I know the building trades do, and I know that I think some of the others do. But a lot of jobs in the service industry, people can learn on the job. They don't necessarily have to go to an apprenticeship program.
Well, can I ask you real quick? Can the unions come to Midway if I work with you and I work with the AFL-CIO? Because they're not gonna go down to Camden Yards. They're not, because they don't have a transportation. Okay. Thank you.
Rex, I just have another question. How do you see the skills gap impacting the ability of your members to access jobs with a family supporting wage within the accommodation industry? Like, what do you see the impact?
Specifically, sort of how do they move up that job ladder? Yeah. So there's a couple of ways that we do that, try to deal with that. And this also deals with sort of a race inequality issue too. And I want to give an example. At BWI Airport, a lot of Baltimore City residents work in Baltimore and work at the airport. And we did a study in 2017 that the majority of the jobs in what we call the front of the house, the bartenders, the waiters, were filled by white men and women, and more of the back of the house jobs were disproportionately filled with African American members. So in the places we've been able to unionize there, we were able to say, look, when the promotions are available, you have to post them, you have to give people an opportunity, you have to promote people by their years of service. And through that, we've been able to get more of those folks that are in the back of the house into the front of the house jobs, because you can learn on the job how to be a server, you can learn how to be a bartender, you can get those skills at work, but we have to kind of press the employers to say, look, it might be easier to go outside the workforce, but we want you to promote from within. So that's really key. So in a hotel, someone could start in, say, as a steward making, $14 an hour, but get trained as a banquet waiter, and as a banquet waiter, they can make $45,000 or $50,000 a year. So those kinds of ladders within a hotel or restaurant are very, very important to move up economically.
Thank you. Councilwoman.
Thank you, Madam Chair. This is for Director Perkins-Cohen. So this first question, I just wanted to know, did you have any ballpark? And just to be clear, this is about something I feel that we can control right away, and these are city vacancies. Do you have a ballpark figure on city vacancy jobs, maybe related to labor jobs within Baltimore City that are not filled? Do you have the amount?
I just want to make sure, do you mean city government vacancies?
City government vacancies.
I do not have that. I can work with my peer, Director Herbert, to get you a...
And Madam Chair, if you don't mind, if we can get that information. Thank you. My second question is still related to city vacancies. You spoke about the workforce centers. You spoke about the satellite centers and bringing resources together. In regards to job training, I just want to know, hey, can you just give me more information about the pathway and how you're working with, say, our nonprofits, our other organizations, local unions like Unite Here, Local 7, just for how are we going to fill those vacancies that we know are coming due to the amount of city employees who we know are retiring? How do you work with these organizations to fill those vacancies, and are we making sure that people are going to be trained for those upcoming vacancies? What does that look like?
Sure. So thank you for the question. It's a good one and a really important one. I think there's two ways. First is in some circumstances, we're actually able to fund training. I referenced sort of two, and I'll reference a third. The first is the first two on the youth side. WIOA funded, that's the federal acronym, stands for Workforce Innovation and Opportunity Act. So we have an RFP, training providers apply, we fund a certain number of seats in their training programs. I also referenced Grads to Careers, where we go into the high schools. The third is something called individual training accounts. These are also federal funds. You might think of them as a training voucher. It's not literally something you hold in your hand, but for eligible training providers, and you have to be on a state-approved list, we're able to fund a portion of the cost of training. It could be the full cost of training. It just depends on how expensive the training is. So we do some of that on the funding side, not as much as we would like to at all.
And that funding, you said it was federal dollars? I'm sorry to cut.
It's federal dollars, yeah. I mean, it goes from the federal government to the state to us, but it's federal. Its origins are federal dollars. But the other way we work with these training providers is they're part of a sort of a trusted partner network. So really, what we're trying to do is have this trusted partner network so that every job opening that we become aware of, whether it's city government or outside city government, we put those job postings out to this partner network. They have their resumes come through us, and that way we have a nice big pool for the employer to find the best qualified candidates so we can make sure that city workers have access to those jobs. And I'll just give a couple of examples. Port Covington isn't sort of rocking and rolling yet where we have a lot to talk about, but for example, on city schools, on the 21st century money for the 25 plus or so city schools, where MOED is the sort of front end partner. We're no longer just sort of saying, hey, who's the best person who happened to come to our centers? We're putting these notices out. All of these jobs pay more than $20 an hour. We're talking about the construction side of the house. And we have this partner network who is funneling qualified candidates again. So we're trying to make sure that, for one is you're trying to build this workforce system that works, right? So that there's this pathway to go from where you are into training and then having access to a large pool of jobs. And this is the best way we can do to coordinate workforce. So even if we're not funding the training program, there still are partners where we're referring people into the programs. They come to our centers, they say, I want to be an electrician, I want to work in the healthcare field, and we refer them to a training partner that provides occupational training. And then on the other end of it, we go back to those training programs and say, here are the jobs that we know are available, city government or otherwise. Have your graduates apply, and we'll go through the pool to select the best qualified candidates.
Okay, thank you.
Thank you.
I just have a question for Mr. Brown and even Dr. Lucas. You guys made a lot of suggestions that I think are pretty good. You can come up together. How have you guys tried to reach out to the school system, to the CEO? Has anybody taken it that far?
Not necessarily the CEO, but we work with Mervo directly. So, I mean, we've done things with them, and there are, as far as we're concerned, because we're a restaurant, there are culinary programs throughout the city that we try to stay in contact with, but mostly it's been Mervo that we've been in contact with.
Okay.
But we have not reached out directly to, CEO.
I'm just wondering, you just gave a lot of good suggestions, and I'm wondering if the top has heard it. Dr. Lucas?
So with the Warnock Foundation, we did start an initiative to address the literacy issues, but we also support Green Street Academy, which provides a lot of job training, preparing students for for the workforce versus preparing students just for college.
Okay. Thank you, everybody. This was helpful to get us started. I appreciate it. We're going to be in recess until the next hearing that we have. So have a good night, everyone.
Thank you.